Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone and have a good time ladies and gentlemen. First of all, I would like to thank good Allah Subhanahu wa taala who has been giving us blessing and mercies so we can attend today's in a good condition. So guys, may I have your attention? My name is Cecilia and I will be moderate in this discussion.
About disease, any harmful deviation from the normal structural or functional state of an organism, generally associated with certain signs and symptoms and differing in nature from physical injury.
The topic of the discussion today is about disease. The presenters are Anna, Irma, Lala, and Aska. Moving along to our session, please welcome Anna.
Feeling of unease, such as worry or fear that can be mild or severe. What causes it? First, stress. Stress because not having much or control of a situation. 2. Other medical causes such as depression, like always feeling guilty and blaming himself. 3. First degree relatives with generalized anxiety disorder. 4. Environmental concerns such as child abuse, like experiencing physical violence. 5. Situations such as surgery or occupational hazard. 6. Substance use, like taking illegal drugs. Treatments that can be done. Treatments will consist of combination of psychotherapy, behavioral therapy, and medication.
Flu influenza is a common infection viral illness spread by coughs and sneezes. It can be very unpleasant, but you'll usually begin to feel better within about a week. Symptoms of flu: 1. A dry, chesty cough. 2. A high temperature fever of 38 Celsius or above, tiredness and weakness. 3. A headache, general aches and pain. The best remedy is to rest at home, keep warm, and drink plenty of water to avoid dehydration. You can take paracetamol or ibuprofen to lower a high temperature and relieve aches if necessary.
Coronavirus and other respiratory infections such as flu and spread easily and cause serious illness in some people. Symptoms of coronavirus are continuous cough, high temperature, fever or chill, loss of or change in your normal sense of taste or smell, shortness of breath, feeling sick and being sick, sore throat. Coronavirus can be handled with stay at home and avoid contact with other people if you have symptoms of a respiratory infection such as coronavirus. Is gonorrhea. Gonorrhea is a sexually transmitted infection caused by bacteria. Gonorrhea is passed from person to person through unprotected vaginal, anal, or oral sex. It can also spread through sharing sex toys that are not washed or covered with a new condom every time they are used. Infected semen or vaginal discharge gets into the eye, or it can also be passed on to a newborn during childbirth. Gonorrhea is treated with antibiotics, which are usually given as an injection. Some types of gonorrhea become resistant to antibiotics. This can make it more difficult to treat.
Insomnia is difficulty getting to sleep or staying asleep for long enough to feel refreshed the next morning. What causes it? First, stress and anxiety. 2. Poor sleep routine and sleeping environment. 3. Lifestyle factors. 4. Mental health condition. 4. Physical health condition. 5. Medication. Treatments that can be done. First, good sleeping habits. 4. Cognitive and behavioral treatment. 3. Sleeping tablets.
Kidney stone is a stone to block part of the urinary system, such as the ureter and urethra. To avoid getting kidney stones, make sure you drink plenty of water every day.
Epilepsy is a condition that affects the brain and causes repeated seizures. Categories of epilepsy are idiopathic and symptomatic. The next is bipolar. Bipolar disorder, formerly known as manic depression, is a condition that affects your moods, which can swing from one extreme to another. People with bipolar disorder have episodes of depression and mania. Symptoms of bipolar disorder depend on which mood you're experiencing. Unlike simple mood swings, each extreme episode of bipolar disorder can last for several weeks, and some people may not experience a normal mood very often. What causes bipolar disorder? The exact cause of bipolar disorder is unknown, although it's believed a number of things can trigger an episode. The following treatment options are available, that is, medication to prevent episodes of mania, hypomania, and depression, medication to treat the main symptoms of depression and mania when they occur, learning to recognize the triggers and signs of episode of depression or mania, psychological treatment, and lifestyle advice.
Laryngitis. Laryngitis is inflammation of the larynx. Symptoms of laryngitis can begin suddenly and usually get worse over a period of 2 to 3 days. Medical help. You should seek immediate medical help if you experience breathing difficulties. Treat laryngitis. Lonesome. Avoid smoky environments. Drink plenty of fluids and try to raise your voice as much as possible.
HIV, human immunodeficiency virus, is a virus that damages the immune system by infection and destroying CD4 cells. Will remain in the patient's body for the rest of his life. If HIV not treated, HIV can get worse and will develop into a serious condition called AIDS, acquired immunodeficiency syndrome. AIDS is the final stage of HIV infection.
Depression. Depression is a group of conditions associated with increase and decrease in a person's mood. Depression does not have one single case. It can have a range trigger. The next disease is malaria. Malaria is a serious tropical disease spread by mosquitoes. If it isn't diagnosed and treated quickly, it can be fatal. Symptoms are similar to those of flu and usually appear 6 to 30 days after the mosquito bite. The initial symptoms of malaria include 1. A high temperature or fever, 2. Headache, 3. Sweats, 4. Chills, 5. Muscle aches or pains, and 6. Vomiting and or diarrhea. Malaria is caused by the Plasmodium parasite. The parasite is spread to humans through the bites of infected mosquitoes.
Asthma. Asthma is a common long-term condition that can cause coughing, wheezing, constrictions, and shortness of breath. What causes asthma? Asthma is caused by inflammation of the small tubes called bronchi that carry air in and out of the lungs. If you have asthma, the bronchi will be inflamed and more sensitive than usual. Common asthma triggers include house dust mite, animal fur, pollen, cigarette smoke, practice, viral infection. Asthma can develop at any age, including in young children and the elderly. Treatment based on two important goals, namely relieve symptoms, prevent future symptoms and attacks. For most people, this will involve taking the medication occasionally or more commonly on a daily basis, usually taken using an inhaler. However, identifying and avoid possible triggers is also important.
Migraine is usually a moderate or severe headache felt as a throbbing pain on one side of the head. There's no cure for migraines, but a number of treatments are available to help reduce the symptoms.
Diarrhea is a pacing loser of more frequent stools than is normal for you. More cases of diarrhea clear up after a few days without treatment, and you may not need to see your GP.
Thank you for that excellent presentation. Thank you to all our presenters today, and thank you for attending this session. Now, it is time to invite your participation. If you have questions for this group, please raise your hand and introduce yourself. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.